So the primary function of the lung is, as we know, is matching blood with gas and allowing exchange of oxygen and CO2 between the air and the blood. The lung takes away CO2 and gives oxygen to the blood. So the primary units of the lung is what we call the alveoli, and a constellation of alveoli is called lobules or acinar units. Those are the units that are responsible for the gas exchange. So what is a lung nodule? Lung nodules is a small soft tissue growth inside the lung that can be one of very few things. The most worrisome finding would be a tumor. The lung nodule can be a very early cancer. It can be benign or malignant tumor. It can be primary or secondary. If a spot is less than 3 centimeters or 1 inch, the lesion is called nodule. It's a small, tiny one. We call it nodule. If it is larger, we call it a mass. And when it reaches a size above 2 centimeters, the chances of that nodule being cancer is very high, about 80%. In August of 2011, there was a very large trial that showed clear benefit, 20% reduction in mortality for detection of lung cancer through screening program. And it identified who need to be screened and how to screen them. So if a patient smokes or smoked 30-pack year, has history of 30-pack years of smoking, or 1 pack per day for 30 years, or 2 packs per day for 15 years, he definitely qualifies for lung cancer screening. And the lung cancer screening is with annual low-dose CT scan of the chest. If we identify stage, this is the same CT scan that I mentioned earlier. This is a stage 1. Stage 1 has more than 50% survival for 5 years, more than 50%. And in appropriate selection, appropriate staging after surgery, if it is proven stage 1, this is a chance for cure, 100% cure. You need a follow-up for like any other cancer, which we will talk about. Stage 4, on the other hand, has a 2% survival for 5 years. So that's why it's very important that we detect them. 80% of lung cancers are identified at stage 3 and 4. So the chances of recovery is less than 2% when it's identified. That's why historically lung cancer is known to have average survival of 18 months. Fortunately, we have all the resources in this community to deal with these issues. I'll talk about options in general, and they're all available in this hospital, around this hospital, for treatments. A new tool came to the market is what we call a navigational bronchoscopy. So they came up with a new machine that has electromagnetic field. You put the electromagnetic field underneath the patient, you load the CT scan inside the computer, and you see under direct visualization, and once you reach the blind spot where you can't see, the computer will direct you, will tell you to turn left or right. This is a VATS procedure that will remove part of the lung that is affected with cancer. And it's minimally invasive. This cuts under electricity, and it will have less bleeding once the lesion is removed. You see the actual size of the surgery. So this is a very small part of the lung is removed. So most of the challenges in this process is coordination of care, because patient will get a diagnosis of lung nodule, it will get forgotten. There will be no standard referrals. There will be no standard workup, and 3 years later, just like my other patient, the cancer grow, and no one will give that lung nodule an importance. So one of the projects that we're working on is to create a lung nodule program, from identification to evaluation to follow-up to workup and treatment. This is a small diagram that shows some benefits of tobacco smoking. At 1 week, your sense of taste and smell will improve. At 3 months, the lung function will improve by 30% if a heavy smoker with COPD. In 8 hours, excess carbon monoxide will get out of your body. In 1 year, you save $4,000. In 1 month, better blood flow and improve in the skin. In 5 days, most of the nicotine is out of the body. In 12 months, your risk of heart disease is halved. And in 9 months, the risk of pregnancy complications is the same as a non-smoker.